Ms. Tripoli, your testimony about the challenges consumers have to understand the price of health care services from hospitals was impactful. I represent a district where almost 70% of households reported speaking a non-English language at home as their primary language. This often reduces one's ability to understand complex paperwork and the consumer protections that may be in place. How can we address unexpected hospital and medical bills in a way that is inclusive for people who are not fluent in English?
Thank you very much for the question. It's a very important one. I think in addition to making sure we actually get the pricing information and unveil it, we have to make sure that we have it translated into multiple different languages. And so I think that's probably the most important step. And that when, regardless of what language you speak, that when you go into the website, a hospital website, and you're actually trying to shop and figure out what the service is and how much it costs, that it's readable, that you can understand it, that it's explained, and there's an explanation, there's an actual price in dollars and cents, simplifying that information so that the American people can actually use the information as the end users of it is critical.
Great, thank you. We spend nearly $2 billion on dental-related emergency room visits per year. Almost 80% of these cases could be prevented with access to routine dental care. I led several bills that will expand access to routine dental care in Medicaid, Medicare, and the Children's Health Insurance Program. How can investments in dental care save money for patients and taxpayers in the long run? Yes.
I think we know that right now we have a healthcare system that treats just the part of our body, but oral health care, dental care is part of our body. And when we have unmet oral health needs that go without treatment, without seeing a dentist or a dental provider, that impacts our overall health in the long run and can actually lead to higher cost care in the long run. So ensuring that we have a comprehensive dental benefit in Medicare and Medicaid and across the commercial market is critical to ensure that every person has the health that they deserve.
Great, thank you. Now, your testimony mentioned how surprise medical bills can lead to high out-of-pocket costs for patients, which in turn can contribute to medical debt. The Biden administration has released guidelines on rules against surprise medical bills. As a result, as many as 1 million surprise medical bills are being prevented every month. What additional actions can Congress and the administration take to build upon the success and continue to address surprise medical bills?
I think the first and foremost is to preserve the No Surprises Act and to keep it whole, to make sure that it's implemented in its entirety as it was intended in statute. We know that there are many threats to the No Surprises Act and implementation, and that directly threatens the ability of consumers to be protected from surprise medical bills. So I think first and foremost is protecting and continuing the implementation, robust, strong implementation of the No Surprises Act.
Great, thank you. Lastly, your testimony touched on how health outcomes are worse for people of color who experience higher rates of illness and death across a range of health conditions compared with their white counterparts. We know that Black Americans and Hispanic adults are also more likely to owe money for care. Can you talk about how the issue of medical debt can exacerbate health disparities that already exist in low-income communities and those of color?
Absolutely. I think medical debt by definition, is forcing people into a very difficult position where they can't actually afford their care and they're having to make trade-offs. I think this has a disproportionate impact on low and middle-income individuals, which disproportionately make up people of color. So we have to make sure that when we're addressing the affordability of healthcare, that when we're addressing the root causes, bringing down the price of healthcare at the root, it will help to eliminate people getting to the place where they have medical debt.